Hi there, Susan Bratton. I'm the founder and CEO of Savor Health. And today, what we wanted to talk to you amid the COVID-19 pandemic was some of the things that we're seeing on the front lines with our cancer patients and how similar they are to the COVID patients who are coming home from the hospital and recovering. We received some outreach about a month ago asking for us to help with recipes that are appropriate for patients who have been discharged from the hospital from a COVID-19 diagnosis. And we were really surprised as we started to dig into it with our clinical nutrition team, how similar they are in many respects and how one thing in particular is really, really important for COVID patients. So I'd like to introduce you to our COO, Marissa Buchan, and she is going to take it from here and bring her expert advice and insights to this problem and how we can help patients.
Yes, absolutely. Thanks for the intro, Susan. Great to be talking to you all today. And Susan's right. There actually are a lot of similarities between the cancer patients that I've been working with for 10 years and what we're seeing in COVID-19 patients. One of those things being they're immune compromised. So when your immune system's low, you have to be extra vigilant with things like hand hygiene, food safety, and just doing everything you can to kind of prevent infections from occurring. The second thing that we're seeing is a lot of weight loss. So after admission for COVID-19, similar to after cancer treatment, some patients have experienced a lot of weight loss, and finding ways to control that and to reverse it take a lot of nutritional strategies with kind of manipulating the foods that you're eating. And then the last thing that we're seeing are certain side effects that are common with certain cancer treatments, like taste changes, changes in smell, things like that, nausea, GI symptoms. Those are all symptoms that are really common in cancer patients going through treatment. And we're also seeing that in the COVID population as well. So it's interesting how much overlap there is. And even though they're two totally different diseases, there really are very similar management strategies for those. And a lot of them really can be managed with nutrition. And we actually just started a video series. If you look on our YouTube page, you'll see all of our dietitians are highlighting some of these areas, tips for taste changes, tips for nausea, strategies to prevent that weight loss or to reverse it. So there's a lot that the patients for both cancer and COVID can do to kind of maintain their nutrition. And Susan, you also alluded to kind of one area that's emerging in the research, and I think what you mean there is with the glycemic control. That is something that has definitely kind of come to the forefront of people's attention. I think people notice that patients with diabetes and also patients with poor blood sugar control were having worse outcomes from COVID-19. And that's something that applies to all people. So not just those with diabetes, but everyone can do everything they can to keep their blood sugar levels in the normal range.
That's great, Marissa. And how does this relate to the cytokine storm that patients are having? And are there any nutritional strategies with respect to that, either kind of pre-COVID or when the patients are coming home? Are the inflammation levels staying quite high, and are there ways to reduce that as well?
Sure. Inflammation is something that you see across the cancer patient, across the COVID patient, and it's definitely something that can't be completely controlled by diet, but I would say that's one of those levers that we as individuals can control, and there is something that we can do. So the best thing that I tell patients to do is to kind of follow an anti-inflammatory diet to the extent that they can, and what that includes is limiting refined flours and sugars. Not that that can't be enjoyed occasionally, but kind of keeping that low, since those have been shown to be pro-inflammatory, along with really processed meats, red meats, things like that can increase inflammation in the body. Things that decrease inflammation are those colorful fruits and vegetables, healthy fats, especially omega-3s that you find in fish, walnuts, flaxseed, then there's the unsaturated fats and olive oil and avocado. Those are all great to include in a anti-inflammatory diet.
Great. Well, that's fantastic. Thank you, Marissa. And we look forward to bringing you more tips like this from our expert dietitians team. Thanks so much. Be safe.